And joining us now is Dr. Julie Marita, Executive Vice President of the Robert Wood Johnson Foundation. Thanks so much for being with us this morning. You know, there's talk from the Food and Drug Administration that it's aiming for full approval of the Pfizer vaccine on Monday. So I'm curious what that will mean for the fight against COVID.
Good morning, Eva. Yeah, the FDA approval, full approval of the Pfizer vaccine really couldn't come at a better time. I think it means for a lot of reasons that people might actually get more people to get vaccinated. There have been people who have been sitting on the fence, maybe waiting for this kind of full approval to actually help them make the decision to get vaccinated. But in addition to that, businesses, schools, healthcare facilities too, some of them have been waiting for this full approval to actually move forward with its mandates. The approval of the vaccine is based on science and real world experience with over 100 million doses, 200 million doses of vaccine administered in the United States. That should signal to people that it's safe and appropriate to get this vaccine, especially at this time when Delta is surging.
Well, and let's talk about some of that real world experience, right? We are starting to hear more and more reports of breakthrough cases. Are you concerned at all about that?
I think we are. As you pointed out there, we are hearing that there are breakthrough cases, but these breakthrough cases are predominantly more mild cases, more mild or moderate cases. So people who are ending up in the hospital being intubated, being ventilated, and dying are actually primarily people who have been unvaccinated. And while breakthrough cases may occur, the key thing is about preventing serious disease and death.
And we just heard in Marcus's piece, the report, the CDC issuing that new guidance saying people at risk for severe illness from COVID-19, whether vaccinated or not, should avoid cruises. What do you make of the new guidance?
Well, Eva, these recommendations are consistent with public health recommendations in general. When we identify people who are at higher risk for serious disease, hospitalization, or death, typically there are more stringent requirements for them. And so for a recommendation to come out of people who are highest risk for dying or being hospitalized, to avoid cruise ships where you're unable to social distance well, where there's lots of people packed in together, it makes a lot of sense and seems isn't appropriate and is appropriate for people with at high risk for disease.
Dr. Julie Marita, thank you so much for being with us this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.